So before I start my sharing, I'd first like to ask one very simple question. So regardless which position you're from within your company, regardless of whether you're an employee or a manager or even a CEO, let's think about what would it be like if all of our teammates within our organization is only operating at half of its potential or at its capacity. How does it feel? So now I also want to ask you, how does it feel if all of the employees are working at their full capacity, energetic, motivated, and at their full potential? How does it feel? Is it very different, huh? So now I would like to talk about the importance of having mental health policy within your organization and why is this important. So of course, from a very business perspective, we'll think about return on investment, or we might think that mental health is just an ethical imperative. But in fact, it is not. Why? Because actually you can imagine or you can think that if employees are motivated, or employees are highly energetic, love the work, enjoy the work, having good mental well-being, of course we will be motivated to go to work, and that would yield a higher productivity. And of course, if companies have a better ESG policy, there will be higher valuation from the investor, and more investor will actually invest in our company. So actually it is not just a ethical imperative, but it is actually a positive financial return, and it is actually a strategy for business, for corporate, and for all of us within an organization, no matter as an individual, employee, manager, or even as a CEO. So very briefly, Chris will also share about some actionable items. That's from our takeaway from my Hong Kong workshop.
Thank you, Cassy. And thank you, Sudesh, for the introduction. So I've recently moved on from the lovely community business and now part of the community business alumni. And the actionable insights and strategies would be prioritizing prevention and early intervention. You see, every role within an organization has responsibility to collectively ensure psychological safety and support the mental well-being of each other. This can be achieved by fostering a cultural and behavioral change among different levels, including from the leadership, management, and also employees. For example, incorporating well-being policy from the leadership level, upskilling managers and HR to support staff mental health, and cultivating skills and culture for peer support at an employee level, so that we can create a supportive workplace environment. When we are designing policies and training within an organization to address mental health, it's essential to be very specific and consider the diverse intersectional needs of different populations, which can be done by consulting the experts here and also your employee and your employee resource group. It's quite shocking for me to know that the average employee assistance program EAP uptake is only 5%. There are many reasons behind it, and we need to study them. Is the awareness and help-seeking culture in place? Often the case, not really. Stigma still exists, and employees have concern about workplace support. You might need to focus on the first step in order to improve access to services. Have we considered the unique needs of different populations? For example, a standardized EAP may not be suitable for the LGBT+ community. It's crucial to find service provider that offers LGBT+ affirmative therapy to ensure LGBT+ employees have assurance in utilizing the service. By giving proper attention to the strategies and actions implemented, we can then establish and sustain a workplace that promotes mental health for all. Back to you, Cassy.
So it is not as difficult as we thought when we do this kind of mental health policy within our organization or within our team. So I myself is not a boss or a manager or a CEO, of course, at our university, but actually as a stakeholder, as a team leader within the university for the mental health project as well, I have a role to play in as well. So actually each individual has a role and then has their own action item to do. I can propose this kind of mental health policy to my supervisor about how we can make the team better. And then if you were a managerial level, of course, you can take charge and then consult your employees or your organizational level from the organization level about what they think about having this kind of mental health policy. What we can do better to ensure that all of the people within the team, within the organization, could actually all contribute to a better mental health and have an even more better supportive work environment. So mental health is always a priority, and it should always be. Thank you.
Thank you, Chris and Cassy. Thank you.